listeners and viewers. You are welcome once again to Health Matters. Health is worth and worth is health on ABL television. Your host, Sakyibea. Please continue to watch us 24/7 on Freeview and on IPTV on ABL television. I would like to say a very big thank you to Delane, my chief encourager. You are always the first person to send comments and feedbacks, which is helping with the delivery of this program. Thank you, sis. Mrs. Gifty Yabua of Olives Catering, I also would like to say a very big thank you to you for always watching Health Matters on ABL television on a weekly basis. Not forgetting my own director and producer, Nana Osajifo. Kudos for this opportunity you're giving to me. I also would like to say a very big thank you to the crew for always helping to help this program for being broadcast on a weekly basis. Thank you, team. I appreciate all your effort and support. Please, my new and old viewers and listeners, don't forget to like, comment, share, subscribe, and press the notification button so that others can also come and benefit from this health awareness program. Today, health awareness, or the topic I'll be discussing or talking about, is on Group A Streptococcus, shortly known as Group A Strep or GAS. If you live in this part of the world or in the world where this time of the year is cold, normally there are a lot of infections that lots of people experience, the flu season, cold season. But this particular year, with this season, there's this infection that is going around called the Group A Strep. So, which has even caused life. It's been tragic. We've had some news. Young children in primary schools and in secondary schools have lost their lives because of this infection. So viewers, is a topic that I will urge you to share once you've heard it. Invite others to come and also listen to it so that we can preserve life. Because once you've shared, you never know whose life you are saving. So what is Group A Strep or GAS, as sometimes you hear on the news or wherever you go? Group A Strep is a bacteria which it affects the throat, skin, the genital or anus. Normally this infection or bacteria stays in the nose and in the throat. This infection mostly affects children or teens or teenagers, but then some adults can also be affected with this infection. So please, let's be very mindful of that. So with this Group A Strep, there are several complications that comes with it if you are infected with it, with this infection or bacteria. And untreated Group A Strep, it can cause lots of diseases such as tonsillitis, scarlet fever, which is now common in the schools. I've not heard one or two. I've heard a lot of this fever spreading around rapidly in our schools. Rheumatic fever, kidney diseases, pneumonia, infection of the ear, skin infection, and blood infection. So you can see this Group A Streps is a very serious infection which as I said, we need to take note of it, and we need to spread this health awareness so others can be saved, lives can be saved. I mentioned scarlet fever, which is one of these complications of that comes with group A strep, is rapidly spreading in our schools. And normally with this scarlet fever, you will see rashes which starts from the face, then sometimes you see around the neck, then later on it spreads all over the body. And normally this rash, it looks like sunburn, or like someone would say a sandpaper. You see, like someone who has, you would think have had a tan, but then it comes with a rash, and sometimes it itches a lot. So if you've seen any of this rash in your child, your teen, or even you yourself as an adult, please seek help. Seek help from your doctor, seek help from your GP, or you can even get advice from NHS 111 by contacting NHS 111 so that you be directed on what to do. So if we know what group A strep is, if we know the complications, so what are the symptoms? What are the symptoms of this group A? How will we know that ourselves, our child, our teen, or someone we know has developed this group A strep infection? It comes with fever. Some people develop feverish, whether with or without chills. You see feverish, shivering, and all that. Fever, high temperature. When we say fever, high temperature, hotness, coldness, it's one of the symptoms. Sore throats, red throats. Some develop red tonsils. If they open their mouth wide, you see their tonsils are swollen or redness of it. Pains when they are swallowing. Someone will say, I can't swallow. When I'm swallowing, I feel pains. It's one of the symptoms of GAS, or what you say group A streps. Some develop headaches, stomach ache, or abdominal pain. Like that pain of you think I'm constantly having diarrhea, or you feel like I've not eaten, and when you've eaten you feel that kind of pain. Please, it's part of the symptoms. Let's look out for that. Muscles pains or body pain or body aches. Nausea, some experiencing vomiting episodes. Someone will tell you, I can't just anything, even water, when I take it, I feel like throwing up. It's the symptoms of this infection. Red or swollen tongue. This tongue, you open, you can see this is not normal. I feel heavy, it feels heavy, it's swollen. Some people have flash face, like a tan face, flash face, or even there are some people, when you look around their lip or around their mouth, it looks pale. You can see this person is pale. It's a symptoms of a GAS or group A streps. Some also develop a deep redness color around their arms, their legs, their necks, their groins. All is part of the symptoms. Then some people lose appetite, don't feel like eating anything. Others also develop rash. So these are some of the few symptoms that I will name, which comes with group A strep or GAS. So please, if you experience any of these symptoms, it might not come in the order I've mentioned, or not all the symptoms that you experience, but any of it. Yes, it might be similar to the cold symptoms, to the flu symptoms. I always say it does not hurt for you to seek for help. And when you go and it's diagnosed differently, at least you get the right treatment. So any of these symptoms that I've mentioned, please seek help for your child, for your teenager, for yourself, from anyone, so that they can receive the help and the treatment needed. So if we know what the group A strep is, the symptoms, the complications, how does this infection spread? When someone who has been diagnosed with this infection, or anyone who with this group A strep coughs or sneezes, it releases the bacteria into the air. So whoever is around that person, unfortunately, might end up catching this infection or catching this bacteria. So anyone who has had this infection, when they cough and sneezes, this infection can spread. Close contact with an infected person, like close contact with this infected persons by sharing their personal items, like sharing the same cup, glass, cutlery, dishes, sharing towels, sharing beddings, sharing toothbrush. I know it doesn't happen most, but some people it does. Some people share toothbrush with others. Please do not, if you know that someone has this infection, personal contact, sharing things with them, please, must be ceased, as it can spread quickly or rapidly through all those things. How is it diagnosed? So if you notice all these symptoms, you can go to your personal doctor, go to your GP, and when you go, normally they will take a swab from your throat. When they take the swab, they'll send it off, culture and all, which will come back and give you an in-depth results. Sometimes they have a rapid strep test, which you can get the results within some few hours. When it comes back negative, fair enough, it might be flu, it might be cold, which you'll be given the appropriate treatment. But if the results come back positive, your GP will give you an antibiotics for you to use. This infection is treated with an antibiotics. So once it comes back positive, you'll be given an antibiotics to use. And when you are given this antibiotics, when you are being given, and it's even any medication, when you are being given any medication or any antibiotic, please mention to your GP if you are allergic, or your child is allergic to any of the antibiotics or medication. Let them know, because if you are allergic to any medication and you don't mention you are giving, it will rather cause more harm than good. So let your GP know about any allergies that you have regarding that. So as I said, the treatment is mostly antibiotics, but then there are some things that you can do at home to ease some of the pain, as I mentioned: sore throat, redness of your tonsils, swollen tongues, body pains, and all that. Aside the antibiotics, if the temperature of your child or you yourself can be reduced, or can be reduced by using paracetamol or ibuprofen. When you are diagnosed, or you get to know you have this infection, please throw your old toothbrush away. and use a new one, because you've been using this and you've been diagnosed. If you continue using it, it will take longer time for you to recover. So please throw your old toothbrush away and use a new one. To help with your sore throat, you can gargle with a mixture of warm or hot water with salt, which can ease the sore throat. You drink warm liquid such as normal warm water, or some people can just drink warm tea, which helps with the sore throat. Drink loads of water for hydration. You can suck on cold ice, like ice pop or ice chips, which will help with the swelling of your tongue, the swelling of your tonsils and all that. If you are not able to swallow, or when you swallow and you're having pains, you can start taking soft liquids or soft food such as porridges and soup, which will help. At least it will enable you to have some nutrients in you, and also you will not have that pain as much as when you are eating solid food. Honey is very good. It helps to ease the inflammation, so you can use honey as well. And some people, with the same as cold, normally when you add honey and lemon with warm water, it eases inflammation. It helps with your cold, so you can use that. And to moisturize your airway, you can use normal saline sprays, which will help you with your to moist your airway. But the most important thing, when you have this infection or you've been diagnosed to say you are positive with this group A strep, please get lots of rest as much as possible, so that your body can recover from this infection. So if we know the symptoms, if we know the cause, if we know what group A strep or GAS is, and we know how it spread, how can we stop this infection from spreading? As I said, it has cost life. Every death is sad, but for you to hear a child has lost their life due to this infection, it means you and I can also do something to prevent this infection from spreading. So what can we do? What can I do? What can you do for this infection from spreading rapidly, as we've heard? We can do that by, when you get to know your child or yourself is positive with this group A strips, please let your child's school know, let your colleagues know, let your employer know. If you're in a church, wherever society you've been, let them know that I've been tested positive, or my child has been tested positive, so that those individuals will know and go to be tested as well. Because when they are tested on time, they will get the treatment that is needed, which will also help stop them from spreading. Because if they don't know, they'll go about doing their normal work. But if they know they've been in close contact with someone who has group A strep, at least they will go and test, and they will get the treatment that is needed. Let's try as much as possible to stay at home when we are positive. You yourself or your child, let them stay at home so that they can recover, or for the fever to settle. If you've been given antibiotics, you've been started on antibiotics, or your child has been started on antibiotics, please, at least you or your child try and complete 24 hours of these antibiotics, because once you've completed these 24 hours, the risk of you spreading it at least reduces. Don't share cups, don't share dishes, don't share forks and other personal items if you know you are positive with this GAS or group A strep. Or if you know someone has this infection, don't share any personal items with them. ask your children to cover their mouth with tissue, or you yourself, if you are infected, cover your mouth with tissue or your sleeve when you are coughing and sneezing, so that this droplets, this bacteria will not be released into the air, so that others will also catch it. Encourage everyone in your house, in your workplace, in your church, or the group you've been to always wash their hands or use alcohol sanitizer on a regular basis, many times on regular basis, because the more it kills infection. Washing of hands and using alcohol sanitizers. So viewers and listeners, if you or your young one is experiencing any of these symptoms that I've mentioned, the sore throat, the fever, all the symptoms that I've mentioned, please, what I will encourage you is to please contact your doctor, contact your GP. You can call NHS 111 so that you'll be tested, and if your test comes up positive, you will get the treatment that is needed. If in some cases, if symptoms persist, if it's very serious, if it's severe, call 999 and ask for ambulance, so they can rush you straight to hospital. If you think ambulance will delay and you can drive yourself, or someone can take you to A&E, rush yourself or your child or your loved one straight to A&E, so the help will be given when needed. As I said, we've heard news of children dying out of this infection. So if it's very severe, don't stay at home. If you think the ambulance will delay, as I said, get someone to drive you. You can call a cab, or or a taxi, or you drive and go straight to accident and emergency A&E for the treatment to be given. So listeners and viewers, please share this information so that many lives will be preserved, and be safe, as this group A strep infection is spreading rapidly, especially in our school. So parents, let's keep watch of our children. If they are presenting with any of the symptoms that I've mentioned, please don't wait at home. Seek help. Go for the help. So that if it's not group A strep, at least if it's something else, as I always say, you'll be given the treatment that is needed and on time. So thank you for listening and watching Health Matters on ABL. Stay safe and be blessed.